Hi everybody and welcome back to the second year of the Nursing Associate podcast. You're here with your host. My name's Noel. I've managed to successfully pass my first year. And with me today is some of the old crew. We've got Alex, we've got Harriet, and we've got Emma. And also joining us today, again for the second time, is Kate. And we also have a fresher with us today, and that's Ozzy. Would you all like to say hello?
Hello!
Right, guys, so what's the second year podcast going to be all about? Well, we've got a variety of topics which are all interesting, but the first one we are going to discuss and look at is placements. This topic certainly brings out a variety of opinions with everybody who's involved, and I know everyone's got their own personal take on it, but we're looking for good practical advice and certainly the do's and the don'ts, things we can maybe let people know to pre-warn them about, and certainly if you are having problems, how we might go about solving it. So, Alex, would you like to kick us off and let us know some of your practical thoughts on your placements so far?
So I think, good afternoon everyone. So I think firstly, being on a new placement where there's all unfamiliar faces and they're all looking at you wondering, what are those yellow epaulets for? You just introduce yourself, explain that you're a trainee nursing associate and that you're here to be a student and learn medications and things, and not to just be thrown sort of as a number as opposed to being a student actually there to learn. I think it's very easy to go to a placement and the nurses just say, oh, just go and see so-and-so, and you just have to be quite assertive, I think, when you join a placement.
It's an interesting, you mentioned a couple of points. If I just sort of rewind you slightly, walking through the door, if we call it a metaphorical door, walking through into that environment for the first time, what are some of the things we've all encountered around this table? How about you, Kate?
Very scary.
Yeah.
I would definitely say it's worth going to your placement area before your first shift as a student. Excellent
advice. I couldn't state that one enough. Top of my list.
The other thing I would say is when you find out that's going to be your placement area, give the placement time to realise that you're going there as well before bombarding them with emails trying to get there, but also don't leave it too late that you appear unorganised.
It's interesting you say about the emails. A good bit of advice for everybody is, you get told about your placement and you get given a variety of contacts for that initial placement. Two really good bits of advice. Sometimes those contacts are out of date. So if you're wondering why no one's replying to you, that's possibly one of the reasons. Second of all, do try more than one contact method. There's often phone numbers, or you certainly know where your ward or area is, and you can search online for other numbers. So again, we're all adults, try and be proactive about that. But I agree with you that when you go work in these environments, you realise that let's call them your assessors, your supervisors, these people that are supposed to be replying to you, they're not sitting at a desk looking at their emails. They're on their feet like we are, for a good 12 hours a day. So sometimes there is going to be a bit of a time delay in people coming back to you. But yeah, that's a really good point. Emma, any pearls of wisdom?
I would say that research is your friend. So you're going to get allocated your placement, and this is going to be available to you on the ARU.
The eVision.
The eVision platform.
I get confused between the two still.
So this is going to be available to you way in advance. I would say have a look, get familiar with what your ward does, what happens at your placement, what kind of illnesses are you treating, and just go off and research those things. and that will stand you in good stead. When you walk in for that first time and people are throwing acronyms around, it's just much easier to understand what that might mean if you've got some idea.
We're all nodding to this that Emma's saying, because it again, really fantastic points. Because I think certainly talking to other people, some people just rock up on day one and expect someone to open the doors and go, welcome, this is what you're doing today, you're going on a cruise. And the reality is that's not the case. Emma's hit the nail on the head. You've got to research. And that goes back to what Kate was saying about being pre-organised. Go and see where your placement is, because 9 times out of 10, no one knows where to park, how long the journey's going to take during traffic on a morning, all of those basic things, which really, at our age now, we should be able to do without having to be told. So just getting yourself all prepped and ready means that if you turn up on time, knowing within reason what you should be doing, you're setting yourself up for a great first impression, which usually then means the people that you're impressing will then go, oh, this is lovely.
Well,
And,
I found it helps
yeah.
for me to be taken more seriously. People then are more helpful towards what I want to achieve when I'm there.
Yeah, and I think also a very valid point as well that you were talking about earlier was that if you want to know something, ask the nurse, because sometimes the nurse will just assume that you're just watching what they're doing, and if you're not sure of something, definitely just ask.
I know we can't swear on the podcast, but there is a famous saying that assumption is the mother of all somethings, and it's true. I think a lot of assumptions go on. We assume, I think, how we're going to be dealt with, and likewise our assessors and supervisors will be assuming as well. And it probably brings me on to another cracking bit of advice, which is don't be afraid once there to sort of go, can we set the day up like this? I've got these proficiencies. This is what my university is looking for me to achieve. As I haven't worked here before, what do you think is the best way we can achieve this? Instead of maybe demanding, which I don't think goes down very well with people, but actually engage them in a live conversation that hopefully everyone gets something out of it. What do you think, Harriet?
I was going to say on that subject, one of the things that I found the most helpful is that I have a folder that I take around with me to both university and placement, and in that folder I include whatever welcome pack I've been given by the ward for that day or that placement. I include sort of things like, this is all the practice proficiencies I've got to achieve throughout the next couple of placements, things about nursing associates, because I've been to placements and they go, what is a nursing associate? And so I've got a nice pack of information, also timesheet, and then I can go to sort of the nurses, this is what I can do and this is what I need to learn. And sometimes nurses don't have the time to log on to a computer and load up an e-pad, and if you have this is what I need to learn, you can have a 0.5-minute conversation. These are all my proficiencies. What can I sign off here? And what can I not? And it makes you look organised. And people, back to that sort of point of attitude, people are far more helpful to you, I found, if you demonstrate an enthusiasm. I often go to places, I'm a mental health student. My background is in mental health. I have no idea what I'm doing here, but I'm going to give it a go. And just showing that attitude of being open and also being helpful, I found to be very, very useful in my experiences.
I mean, wherever you go in life, I think if people can see you're showing them respect, for like turning up on time, looking smart and presentable, taking an interest in where you're going, it inevitably will come back full circle, and they will then respect you in what you're trying to achieve, and it's a sort of win-win on all sides. We've all been exceptionally positive about our placements. I'm sorry, I shouldn't laugh. Let's be honest, there are problems when it comes to placements. And I don't want people to think, oh my God, I'm living in fear of my placements when they listen to this podcast, because a lot of our placements are great fun, and we learn lots about how other people operate, because for me, I work in the community background. So when I first went on to award, that I went in on day one thinking, oh,